So this is the TROM knee brace. This video is going to demonstrate how to take it on and off when you're at home. This should already be preset to whatever Dr. Bynum would like when you head home from the surgery center. So do not adjust these pieces here until told to do otherwise. So this is just simply to show how to disconnect the straps and to adjust it if you're wearing something that is a little bit thicker or a little bit thinner. So you'll undo little clips here to where the brace is open. For this demonstration purposes, the patient's sitting in the chair with their leg completely extended. If this is not a position that you can get into at home or comfortably, you can do this while a patient is laying down on a bed with the leg completely extended out. So go ahead and put it behind the leg here. You want this top piece to be about halfway up the quad. Move it up somewhere. Another way to kind of make sure that it's in the right position is to take these circular pieces here and feel for the knee or view the knee, and you want one on each side. So it needs to come up just a smidge more. There you go. So once you have it there, you can kind of attach whichever one you prefer first. It doesn't make a difference. Okay, so once all your clips are attached, you then want to tighten down the straps to where it's snug and it's not going to slide. So what you can do is feel for this Velcro piece here, you want to detach the strap from there and feel on the back to make sure there's no slack, which there is some slack, so I'm going to go ahead and pull it. Once I feel it's snug, I'm then going to attach it to the Velcro so that stays in position, and then I'm going to pull the strap tight here. These straps tend to come a little bit long. You are able to cut these if you'd like, but I would recommend leaving some extra strap just in case you wear something thicker. Obviously this is a thin material, but if you wear jeans or some sort of baggy pants, you want to make sure you leave yourself enough room. This can also come off here. So I went ahead and bent the strap back. You can do that if you'd prefer as well. Reattach this Velcro and bring it around until it attaches to itself. I'm gonna go ahead and do that with each one of these. Feel on the back, there's a little bit of slack there, so I'm gonna detach this, pull till it's snug, and then pull a strap like this. This one should fall right below the knee. So if you feel like it's coming up and it's kind of touching your incision or anything like that, you can adjust this. There are little adjustments here on the side to bring it up or down, but you want it to be placed right above the knee, or excuse me, right below the knee. Same thing, attach it to itself. This strap here is pretty important to keep snug because this is what's going to prevent the brace from sliding down when you're up and moving around. So I'm going to feel. Go ahead and pull it tight like that. And lastly, this quad one here. All right. Okay, so I would recommend having your patient stand up after you put it on to make sure that the brace doesn't slide when they stand up. If they feel like it's slid any which way, you can adjust this strap up here, this one down here, make it a little more tight so it keeps it in position, and then make sure that these circular pads are on each side of the knee. So at this time, this brace is locked in extension. So if Dr. Bynum or your therapist tells you that you can start to have more range of motion when you're up and moving around, once you're locked like this, you can then push these red pieces up on each side, which will then unlock it, and you'll be able to bend it to whichever degree it is set at. Then when you're up, once you need to lock it back in position again, you'll then completely extend it out to where the brace is straight, and then push these pieces down, so that way it keeps you locked in extension.